Hi, everyone. Welcome to the series Overcoming Burnout, the Journey of the Health Architect, in which we talk about different ways that physicians can approach their clinical work to make it more rewarding and fulfilling. My name is Venkatesh Ramnath, and I'm a physician in California. Now, you may be wondering, why are we even talking about this, and what is a health architect anyway? Well, I don't think it's a leap to say that physicians today are in a bit of a crisis. And this is happening for several reasons. First of all, there is too much medical information out there. About 1 million papers show up every year. That's 2 papers a minute. And that's actually information that we know from 8 years ago, not to speak of what might be happening today. And we don't even know what might be retracted tomorrow, since the number of retractions is actually going up over time, with medical fraud even infecting some of our most respected research institutions. So physicians are kind of left on the back foot around differentiating between what is fact and fiction. Now, at the same time, we've got so much medical technology out there. We're all pretty much comfortable with the electronic medical record these days, which has its advantages, but it also is a burden. And on top of that, we've got telemedicine, synthetic biology, gene therapy. There are medical devices like sensors and wearables. And we haven't even touched on AI and data systems, which are affecting pretty much every industry and is actually entering into healthcare as well. So with all these different technologies, we're sort of unclear about how to choose the right one and how to apply it to our patients in the right ways. We also know that patients these days are going to so many different care locations, from urgent care centers to freestanding ERs, to rehab centers, and then even when it comes to hospitals, we've got differentiations between primary critical access hospitals to secondary community hospitals, and then there are tertiary and quaternary academic medical centers, which offer some of the most specialized and expensive resources and personnel. And we know the general differences between these places, but we don't know the nuances or the details, and especially as patients are asking us for more and more help around how to navigate these places and the choices they're in, we're not terribly confident about that. At the same time, we've also got so many different people we work with as part of healthcare. There are physicians, and of course, we are differentiated between primary care physicians and specialists, but also with subspecialists and now sub-subspecialists. But even when it comes to non-physician medical providers, we have everyone from nurses to pharmacists to speech pathologists, and the list goes on and on. And we're not traditionally trained as physicians to know what these roles are, understand the skill sets that they bring, and integrate and coordinate and collaborate with them in these multidisciplinary teams and lead them in order to allow the best care plans to be executed. Finally, we all know that healthcare is becoming more and more expensive. And yet we as physicians are kind of unprepared for the questions around financial viability of the clinical programs in which we work. We feel pressured when we're asked questions about productivity and RVUs, and we don't know what a case mix index is or what a payer mix, how that affects me, or why do I need to adhere to these coding rules and these documentation requirements. And we don't really know how to interface and interact with the administrators around these issues. And so all these pressures in totality have now weighed on our shoulders, and they've really created stress. They've also led to questions. Some of them are practical around what do I do and how do I do it? But then some of them are also existential around what does it mean to be a physician today? And who am I as I'm trying to take on these roles that I'm not really all that comfortable or trained to do? And that's led to two different phenomena. One of them is called moral injury, when what we feel is reasonable and fair conflicts with what other people want us to do. So we feel annoyed or upset when we have to take our work home and finish our notes or check up on tests when we should be really with friends and family, kind of decompressing from the day. We feel frustrated when we're trying to do all the paperwork to get authorization for medications or services that our patients need. And we feel really annoyed when we're trying to jump through all the hoops to try to get our patients from one care location to the next. And when this happens, that stress transforms into distress and finally injury. And when this accumulates over time, we feel unvalued, we feel unappreciated, we feel emotionally and physically exhausted, and many have termed this burnout. Now, what has been the response by the physician community around moral injury and burnout? And what are the options that we have looking forward to deal with these? Well, we're going to deal with that in the next segment. So I hope you join me then.